As a quick introduction, I'd like to say thank you for choosing my CV and putting some time aside to interview me. I have 20 years experience working in the public sector, 10 plus years experience working as a project and program lead manager. I have service redesign experience, commissioning. I have worked for various different health areas across the Department of Health, NHS England, CCGs, local authorities, Ministry of Justice, community providers, London Fire Brigade. I've geographically worked across London as well. And I just would like to thank you for taking time to see me, and hopefully you'll enjoy this presentation. Thank you. The question that's been asked of me is how would I use my project management skills and experience to support the Digital First program? Well, in a very simple way, I would use my experience, my relationships and engagement skills, and my organizational skills to help with this program. It's very important that in any project, you understand the project, you understand what issues and problems may crop up, and you also have to understand potentially how you're going to mitigate those so that it doesn't adversely impact on the project's outcome. I feel that those three key areas of experience, relationships, and organization are my core skill set that would help with the question at hand of how I would be able to support the Digital First program. I'm not going to go over my CV in this part because you've already seen it and we've already done introductions. However, the two key areas are regarding my experience and how I would use this to support the Digital First program relates to my time working with Mike Part when I was the interim London Digital Program lead, working alongside the London County Partnerships. There was quite a big work stream there with 14 plus work streams, and we were doing the proof of concept for sharing electronic records across various organizations and various different IT systems. There was a lot of work around the business case, developing the business cases for the projects, developing the project documentation, and also a major part was leading and program managing the project managers who were in charge of having develop the STPs at the time and the digital content. I also was working prior to that with Bromley CCG and the local borough on developing their own integrated care records system, and also a clinical decision tool at the DXS, Rezo, and developing a hub for a walk-in centre where the local GP network were sharing basic patient records there to allow different providers to provide that service. Experience is very key in this area as far as it allows me to hit the ground running. It allows me to successfully deliver projects in areas where I haven't worked before, and allows me to quickly understand the political and the environment to best provide the service required. The second key area that I think is very important to being able to support the Digital First program as far as my experience in project management and my skill set is relationships and engagement. This area particularly applies to short-term actions, but obviously also long-term and medium-term. But I feel that over the last 20 years, I've really been able to develop my engagement strategies, my being able to manage expectations and the relationships. And over the years, I've learned that it's very, very important to onboard people early. That helps with the success of a project. It helps if you are able to promote your agenda and make it part of someone else's agenda, or make it seem like it's their idea, or actually get them so involved that the things are their ideas. This way, they have a lot of buy-in for the project. The more buy-in they have, and the more engagement, the more from an early stage, the more likely it's going to be successful. I think it's very, very important to have engagement and relationships with people. And it's very important to quickly find out who the key people are, whether that's someone in IT or within a senior clinician or within accounting or whoever it is for the particular project. Engagement super key, and I've got experience within engagement, working as a project manager, patient engagement, obviously a lot of stakeholder engagement from chief executive level all the way down to user level. I'm used to running workshops. I'm used to getting feedback and evaluating it and inputting it into the business plan or the PID or whatever stage we're at the project, and ensuring that people get buy-in and they sign off on that. The third and final area that is really, really important as far as my experience and skill set where I can support the Digital First program is my ability for organization. I'm Prince 2 practitioner qualified, and I'm used to using systems such as Clarity or SharePoint or for different project management tools. However, it's different horses for courses. I've been working in organisations such as the HMCTS, where it's been a very high level project where you had the Ministry of Justice involved, and every single I had to be dotted, every single T crossed. So we had a spreadsheet for everything. We had issue logs, we had raid logs, we had communication plans. Every single type of project and program management tool set, we had implemented it. I've also worked in other organisations, such as CCGs or local authorities, where the level of project management understanding or methodology has been zero. And I've set up complete project management programs from the ground up in places like Croydon or Bromley, West London, and I've supported the staff to do flash reports or just supported the staff on how to find access things such as SharePoint and organisational things. But I really feel the success of any project, and especially in regards to medium or long-term issues, which you need to mitigate, is organisation, organisation, organisation. This is really, really key. The more organised you are, the less likely things are going to be to slip through your fingers. So that is really, really one of the key areas. To wrap up, I'll use my experience, my relationship and engagement skills, and my organisation skills to support the program. I can add value, I'm able to relate and communicate, and I'm adaptable. I have a lot of experience within analytical, stakeholder management, improving existing processes, developing project documentation, and my preferred way of working is to keep things simple, to adapt to the organisation, and to base my mitigation and my evaluations on my past experience, and hopefully that means that any outcomes and outmeasures are adhered to and that the project is delivered on time, on budget, and within the scope of the project. I would like to thank you for your time, and I'm hoping that I answered any of your questions with this presentation. Thank you very much.